I'm sorry, but you've got prostate cancer. Don't worry though, I've got a treatment for you.
Wow, Doc, thanks. I didn't even realise I had a prostate.
Within the last year, the number of new cases of prostate cancer has been over 16,500, of which there have been over 3,000 deaths. In the simplest terms, prostate cancer is the growth of abnormal malignant cells in the prostate. Common symptoms include frequent but painful urination, particularly at night, blood in the urine, and weakened stream.
While we know the risks of prostate cancer include age, especially when over 50, having a family history of prostate, breast and ovarian cancer, as well as consuming a diet high in fats and low in fresh fruit and vegetables, prostate cancer still remains one of the leading causes of male mortality.
This is where we'd like to introduce Gurnafil, our small molecule drug which is able to induce apoptosis, or in other words, kill the baddies to grow the goodies. By utilizing a G-protein coupled receptor by the name of oxoeicosanoid receptor 1, also known as OXA1, Gurnafil is able to target growth signaling, thus causing the apoptosis of these nasty prostate cancer cells.
In the event of prostate cancer, two enzymes work to produce 5-oxo-ETA, which is the normal agonist of OXA. 5-oxo-ETA binds to the OXA receptor and triggers the G-alpha I and G-beta gamma downstream cascades. The alpha subunit activates adenyl cyclase to increase cyclic AMP levels to activate protein kinase A. This consequently increases Krebs transcription factor to increase cell growth. Simultaneously, the beta-gamma subunit activates phospholipase C, which leads to the activation of protein kinase C, whilst also increasing Krebs and C-Jun, which again leads to cell growth. The binding of 5-oxo-ETA to OXA allows the cell to rapidly grow and further the mobilization of cancerous cells into a metastatic state.
This is where Gurnafil comes in. GU1654 is a biased antagonist of the OXA receptor, selectively inhibiting the beta-gamma pathway by uncoupling it from the alpha pathway. The binding of GU prevents further activation from 5-oxo-ETA and also ensures the disruption of the alpha pathway. This interruption reduces the capacity of cancer cells to increase cell growth. By interfering in these vital cellular pathways, the cell is no longer able to function appropriately, thus inducing apoptosis.
Gurnafil will target prostate cancer cells specifically, relying on high levels of overexpression of OXA in all prostate cancer cells. Because GU is a biased antagonist, it will selectively bind to overexpressed OXA. In doing so, the alpha and beta-gamma pathways uncouple, specifically inhibiting the beta-gamma pathways and preventing proliferative signaling.
In terms of administration, we plan to test IV injection and rectal administration of Gurnafil. Dosages will also require further testing. While it is clear that Gurnafil has great potential in treating prostate cancer, there are some situations in which it may be contraindicated. We must impress that this will require further research in order to definitively address potential contraindications.
We are aware that OXA can also be found on inflammatory cells at much lower levels. Normally, 5-oxo-ETA binding to OXA would cause activation of the alpha and beta-gamma pathways. Should GU bind to OXA on immune cells, it would uncouple these pathways with the potential to cause a mild allergic reaction. However, the competitive antagonistic action of GU ensures that the alpha pathway is not affected in immune cells. The alpha pathway is essential for the function of white blood cells, whereas the prostate cancer cells, the alpha pathway is for growth. Nevertheless, it is important to note that the levels of expression of OXA within prostate cancer cells indicates that GU would preferentially bind to these cells and not to the immune cells.
Gurnafil has the ability to gradually induce apoptosis by directly targeting the OXA receptor in prostate cancer cells. We believe this target is the ideal candidate for treatment because it is ubiquitous in prostate cancer cells. It has a simple and novel mechanism and is important for cell growth, while appropriately targeting the sustained proliferative signaling in cancer cells by inducing apoptosis. As research is furthered, it is probable that Gurnafil as a combination therapy could reduce tumor-associated inflammation, another hallmark of prostate cancer.
Gunafil is a drug like no other, acting to stop proliferative signaling and halt cancer progression in its tracks. By using a small molecule like GU that acts as a competitive antagonist, Gunafil is able to uncouple the beta-gamma subunit from the alpha subunit and its pathways, thus inducing the eventual apoptosis of prostate cancer cells.
Gunafil also produces the room for growth as a drug that has the potential to hit another hallmark of cancer, but this is only possible through the contribution of your support. Hopefully you can clearly see now that this treatment has the potential to change the lives of half the population, killing the bad cells one by one.